So just a nice quick little intro video, just so you can sort of see some of the spaces and a little bit and how people can interact in them. But I'll give now another video which is looking more at the physiotherapy program specifically and just sort of a bit of an introduction to it. So let's again make sure I'm sharing the right screen.
We all start our journeys from humble beginnings, finding our feet in primary school.
Is that working?
We continue this journey into high school, finding our interests and strengths. And after this 12-year journey of exploration and learning, you enter the next stage, finding your passion. Some of you will already be at this stage, looking to further your qualifications to improve your employability. So where to from here? Sometimes the future is hard to see, but let's take a closer look. There are many potential careers ahead of you. There are many areas you may wish to work in, but it is important to pick one that is meaningful to you. We want to focus on one of the better options. Let's take a moment to discuss the role of a physiotherapist. Physiotherapy is a science-based profession and takes a whole person approach to health and well-being. At the core is the patient's involvement in their own care through education, awareness, empowerment, and participation in their treatment. Physiotherapists are experts in movement and function who work in partnership with their patients, assisting them to overcome movement disorders which may have been present from birth, acquired through accident or injury, or are a result of aging or life-changing events through movement and exercise, manual therapy, education, and advice. They maintain health for people of all ages, helping patients to manage pain and prevent disease. Physiotherapy is a degree-based healthcare profession. Physiotherapists work as primary practitioners in a variety of specialties in health and social care. Additionally, some physiotherapists are involved in education, research, and service management. Physios use their knowledge and skills to improve a range of conditions associated with different systems of the body, such as neurological, musculoskeletal, cardiovascular, and respiratory. They get to work face to face, building meaningful partnerships, solving problems in practical and creative ways. As a profession, physiotherapy is predicted to have very strong future growth, low unemployment, and a good rate of full-time workers. The recent pandemic is evidence of this. Physiotherapists maintain their employment as essential workers. The median salary for first-year physiotherapists is a respectable $61,300. In fact, salaries for healthcare workers are already among the fastest growing in the country. Physiotherapists are employed in public and private hospitals, medical rehabilitation centres, community health centres, home care services, aged care facilities, vocational rehabilitation centres, schools and educational facilities, private practice, independent living or respite centres, and elite or local level sporting clubs. We get to work with a huge range of people, from the young to the old. In this case, he's rather old. We can choose to work with athletes, and there is even animal physiotherapy. So, when you are looking to the future, you need to start from a strong foundation. At Federation University, we believe we can provide exactly that. We have brand new state-of-the-art facilities designed specifically for physiotherapy with many exciting projects coming up. If you go down the path of a physiotherapist at Federation University, you will undertake a carefully designed 4-year program that will equip you with the skills and knowledge needed to strive in the profession. The program has been shaped to facilitate a supported and logical learning process, allowing students to build on the fundamentals. Across the 4 years, you will learn the key aspects of the physiotherapy profession, communication, and research skills. In the first year, you will learn what makes the body move and where that can go wrong. This includes the assessment and treatment of muscles, bones, and ligaments. You will be enjoying brand new practical teaching spaces filled with a range of equipment that allows you to practice techniques and methods supported by the latest evidence. We also ensure you are well supported with online resources, face-to-face lectures, and hands-on practical sessions. Our purpose-built rooms create learning spaces that support your creativity, collaboration, and excellence. They are tailored to meet the needs of today's students. In the second year, you will learn what makes the brain tick and the heart pump. This includes the assessment and treatment of a range of conditions, for example, stroke, Parkinson's, asthma, and cystic fibrosis. You will be enjoying brand new simulation environments and access to hospital equivalent equipment. We will also ensure that you are well supported with comprehensive 3D visualization tools to explore the human body in detail. In the third year, you will learn what makes babies amazing and what can be done to help our aging population. This includes fascinating facts like that babies have more bones than adults and how we can help the 4 in 5 older adults that battle at least one chronic condition or illness, such as heart disorders, arthritis, or osteoporosis. You will be enjoying your first major semester of clinical placements, getting real-world experience from clinicians in a range of settings. We also ensure that you are well supported to enter the sporting arena as a health professional with access to high-level strength and performance evaluation equipment. In the fourth year, you will learn how to best help those with special needs improve their quality of life and advance applications of physiotherapy. This includes persistent pain management, splinting, and managing transplant and burn patients. You will be enjoying access to technologies of the future, including 3D printers, which can be used to make a range of anatomical and therapeutic models. We also ensure that you are well supported moving forwards into your profession, including ongoing benefits and engagement opportunities with the university and industry partners. But most importantly, you will graduate as an Australian accredited physiotherapist that will be in high demand at home and overseas. Thank you for listening. We will now open the floor for your questions.
If anyone's got any questions at the moment, happy to answer those, and otherwise we can do a bit of a virtual tour together of the facilities. So you can feel free to unmute or chuck a question into chat at this point.
And I'll keep an eye on that as you're going through, Chris. But yeah, certainly encourage you to ask any questions at any point. So Chris is going to show us a little bit more in-depth view of some of the great facilities that we have here. So a bit of background. There's been a multi-million-dollar investment at the Gippsland campus to set up a fantastic new allied health facility, which we would have loved to have been able to show you face-to-face. Hopefully there will be some opportunities over the coming months to do that on campus. But this new allied health centre, which has just opened very recently, provides some great spaces both for physiotherapy, occupational therapy, and our exercise and sports science program. So I'll hand over to Chris, who can talk about that in more detail.
Absolutely. And Nikki's just thrown in a question, which is, as of next year, is the full 4-year course available at Gippsland campus? Depends exactly on how you're asking that question, in the sense that we don't have cohorts in each of the 4 years next year. We'll have first year and second year, so we don't have, therefore, staffing for third and fourth year. But obviously, you can sign up for the 4-year course, for next year for sure. So if you're looking to transfer from another university, which I have had a few questions about in the past, if it's for third and fourth year, then we won't be able to offer that for next year. But thank you for the question. So if we're going to do a bit of a virtual tour of the space, Easiest way to find it if you're looking to have this again is just FedUni Tour, looking at the virtual tours there. And then obviously for the allied health space, we're most interested in that Gippsland campus. So if we jump on, you can follow through the instructions there. But if we look at specific rooms that are of most interest to us, we go down far enough. So this is that anatomy and physiology room you would have seen in the video at the very beginning. So it's a really great space, really quite open area with lots of resources all the way around the room. And you will see that there's even sort of cameras in the room that allow us for all of our teaching spaces to have them conferencing across sort of the different rooms, or even having obviously external speakers come in and give a conference for us as well where needed. And we can have the 2 projectors, so we can put display documents on the bench, or even use the microscope and have the camera from the microscope actually being projected onto the wall as well. So this has been a really fantastic space for the students to be able to get into and use, and we've certainly been able to have our students continue to attend campus. Being a health profession, they actually fall under the authorised sort of workers, if you like. So for our practical classes that can't be done online, they can continue to come in. We then have, this is called the simulation room. So in here, you can see it's set up as what like a hospital room might actually look like, and has a lot of the associated equipment with it. So you can sort of practice working in that environment as you would when you actually are out there in the real world doing your placement. But then there's the observation room, and we can use this room also for recordings from a teaching perspective, or even from a student feedback perspective, which can be quite helpful as well. We've got a question which is great. How many students are there enrolled in the physio course? So we have only the 1 cohort at this stage, this being the first year that we're running it through, and we've got 34 currently enrolled. We had a few more, but then they've deferred and those sorts of things. And then so for next year, we're looking at taking 45 students. And then with the accreditation process, so we're accredited, but part of that process is a gradual increase in the number of students that can be enrolled. So we're looking to basically max out, if you like, at 60 students per cohort once we've got all 4 years up and running. So it still keeps it as quite a nice sort of close group, and we have really excellent sort of staffing student ratios for the practical sessions as an upside of being a bit of a small sort of group. This is one of the other spaces that we can utilise. So it's again just these nice big teaching spaces with an arrangement of different sort of equipment that we use for the different sort of practical activities that we come across. This is then the main physiotherapy sort of practical room that we utilise. Again, big wall for projections. We have a camera that actually sits above one of the demo beds, and that allows the demonstrations to occur without people blocking each other's ability to see what's going on. So that can get sort of streamed straight onto the wall, which has been quite useful. And again, a range of sort of equipment around the room for the students to sort of really get good experiences with the different things that they might come across within their profession. The second physio lab room looks pretty similar. It's just a bit of a different shape to it. But again, the range of equipment that's available is quite similar. So again, you can see that camera across the bed just to make it easier when we're doing demonstrations and easier from a student's perspective to see what's going on. Brilliant. We've got another question. Thanks very much, Jess. How often are you required on campus? The answer is fairly variable, but I'll talk through sort of some of the main sort of examples of it. So it is a blended course in that we teach some of the content online and some of the content face-to-face, and that would be an intention even if it wasn't for COVID. We've found that some of the content works really well when delivered online, particularly with some of the modules that we utilise for the students. It allows them to be a bit more self-paced. So rather than just sort of getting a lecture thrown at you, you can take it a little bit slower if you're more comfortable to, or you can sort of keep it at the same pace if you're not. So we do have that sort of blended approach. In first semester and in second semester, the students have been required to be on campus 2 days a week, but it can vary depending on sort of timetable and staffing demand. So it won't necessarily always be that for first year, but it'll be typically between 2 to 3 days a week for first year students. But then as the other example, when you get into third year and we're doing those major placement blocks, you are actually expected to be doing this placement sort of reflecting full-time work. So then obviously you're attending the work site, whether that's private practice or a hospital or something along those lines, in that sort of more full-time sort of manner. So a little bit variable, but hopefully some of those examples give you a bit of an idea of what that would look like. And then the only other room that I was going to hunt out is just the anatomage table room. So this is probably, I lecture on a couple of different topics, but anatomy and physiology is certainly one of the main ones. And I spend a fair bit of time in this room with the students. So we do have, this is a really incredible piece of sort of technology that actually has cadavers scanned into it that allows us to really explore the human body in a really detailed way, getting a really good appreciation of how all the anatomical structures interrelate to one another, and then obviously how it then is relevant from a pathology or a rehabilitation perspective can come through. So that should just give a bit of an eye-opening to some of the spaces that you'll have access to if you're a student within the physiotherapy program. The other bit is if you're ever looking for information about applying for the physiotherapy program, I'm sure you would have come across this page already, but quick, Fed Uni Physio search will come up with a Bachelor of Physiotherapy page. And as you're scrolling down through there, you'll see that we only offer it at Gippsland. And we only take intake at the start of the year. We don't have sort of mid-semester intake. And as far as ATAR scores are concerned, it's often a very popular question that people ask, and it's fair enough. It's a competitive process, and particularly with the accreditation process having our numbers a little bit smaller at the beginning, it really is just depending on basically the number of students that apply and what sort of scores they're bringing with them to exactly what the ATAR will look like. So essentially the top, for next year, 45 students will be the ones that get in. So it's a bit hard to predict what that ATAR will look like. So we sort of don't publish one from that perspective. If you're a mature age student, we essentially look at your tertiary education. So if you've come and you've done sort of biomedical science or exercise and sports science or something similar to that, you can certainly apply, and we just look at the marks associated with that. So looking at the GPA, you don't have to have done a medical course previously. But obviously it sort of helps support the application, as I said, given that it's a sort of fairly competitive process. Again, we had the video which talked through some of the career options, and there's certainly the work integrated learning is looking at the placement. And across the 4 years, there's over 1,000 hours of placement time, which gives you guys a fantastic opportunity to really learn the skill sets and knowledge that's required, and that should be applying them in a supported sort of environment, which is quite key. So that's probably the key information that you can sort of track down through that website there. So hopefully some of that information has been helpful, but certainly if you have any more questions for me, feel free to throw them at me.
It's fantastic. Thanks very much for that, Chris, for that guided tour. There's some amazing facilities there. And just to flag with everybody who's in the audience that we will be looking to run smaller group-based campus tours over the coming months. So certainly keep an eye out on the Federation Uni website. As restrictions ease and we've got the ability to bring people on campus, we will be looking to do that so you can actually see those facilities for yourself face-to-face. But yeah, as Chris said, certainly encourage any questions that you might have, any queries about the program. Chris, perhaps one thing I might just ask you as well is, in terms of the placement opportunities that students have, what are the typical sort of experiences that they would have once they go into their placement?
Yeah, so I suppose I'll break it down because the experience actually does sort of transition a little bit as you go across the 4 years. So we want to make sure that you're getting sort of, I suppose, exposed to that, work environment space, but at a graduated sort of manner. So we're not sort of throwing you in the deep end too early. So we do have in first year, so for this semester, we're already getting these guys organised to do what we're sort of dubbing as a bit of a massage clinic, but it's a really good opportunity to start to meet actual sort of patients, if you like, and interacting with them, starting to do a bit of note-taking practice, and getting some of that hands-on skills sort of work through the process as well. So whilst physios obviously aren't limited just to massage in sort of a whole world sort of picture, we do certainly like to be able to sort of have a little bit of practice and at sort of an easy end of the pool, if you like. If you're in the shallow end of the pool, so it's just that introduction. We do some observation work as well. Going into second year, then there's clinical, a little bit more clinically applied sort of stuff that goes goes on. So some of the community sort of rehabilitation centres, for example, would have the students going across and they'd be running exercise-based classes. So starting to see bigger numbers of patients with that, having a bit more of a role in what's sort of going on and being conducted. So not just observation, now you're actually being a bit more involved. And then once you're getting into third and fourth year, then those placements are really to try and reflect what the work environment would actually be like. So you'll be going into, again, whether it's a private practice, whether it's the hospital and doing the rotations around the various wards, you would certainly need to get that full experience and actually start to be incorporated into that staff sort of process at those different placements. No worries, Giuseppe, thanks.